Good Thursday afternoon. I'm Charity Menemy, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to Medic Regional Blood Center and those who have donated blood and plasma during this pandemic. Medic has been working hard to provide incredibly important services to our community, and they need your help right now. They are critically low on blood and need folks to donate. Anyone who is able is asked to please consider making this life-saving decision. For those who have had COVID-19, they also need you to donate plasma if you are able. And thank you to the folks that have already donated plasma. You're truly making a difference in saving lives in our community. For more information, check out Medic's website for details on how you can donate, or you can give them a call at 865-524-3074. For our vaccine update, KCHD is vaccinating those that fall into phase 1A1, and we're starting into phase 1A2 as identified in the statewide plan. Additionally, we will be vaccinating those 75 years and older. This comes after Tennessee Department of Health's announcement yesterday to adopt an age-based vaccination strategy in addition to the phases that had already been outlined in the state plan. That said, we are holding our first public clinic this Saturday at the Expo Center for folks who meet those priority qualifications to get vaccinated. It will be first come, first serve from 9 a.m. to 2 p.m. or while vaccines last. We have allocated 500 doses of vaccine for Saturday, which is as much as we could set aside based on how much vaccine we have on hand and our other previously scheduled clinics set for next week. Those within phase 1A and 1A2 who are already scheduled to receive vaccine through KCHD next week should please still keep their standing appointments. And also, as a note, we will be continuing to reach out to those in the 1A2 category since we're just starting to move into that. So if you haven't heard from us yet and you're in that category, just stand by. More information will be coming your way. Saturday's clinic is for those who meet the criteria and do not have a scheduled appointment to receive the vaccine at this time. All of the details for this Saturday's clinic are posted on our website. We want to stress, though, can't stress this enough, this is not the only opportunity for folks to get vaccinated. As we receive more vaccine, we will be announcing more opportunities, including scheduled appointments. We acknowledge that those future opportunities may be better for some individuals who are medically fragile, as opposed to the open first come, first serve clinic that we are doing Saturday. And just to kind of get off script a little bit, I was around back in H1N1 and actually also during the previous flu shot shortage, I think it was around 2004. And we've seen what can happen here. We've seen the lines of people that wrap around the building. We've seen where people come in and bring their grandma that's fragile and try to wait overnight so that they can get vaccine. And we're asking you, please don't do that. There will be plenty of opportunities. Please keep an eye on those if you have medically fragile family members or if you're medically fragile yourself. There is more opportunity to come, we promise. We want to also say that we've gotten a large volume of calls from folks who want to get the vaccine. A lot of calls are coming in, so there might be waits on our phone line as well. Keep that in mind. And we are happy about that. We are so encouraged that so many people want to get vaccine, and we want that enthusiasm to stay up. But it's important to remember again that this is one opportunity of many more to come. And while we're excited about this yesterday to incorporate an age-based vaccination strategy, it is going to take time, not to mention additional vaccine, to get more opportunities for vaccination scheduled. The bottom line is this: there will be more vaccine coming in the coming weeks and months, and there will be many more opportunities for you to get vaccine. There will be a variety of ways that you can get that vaccine as well to be given throughout the community, not just from us, again, in the coming weeks and months. If this Saturday is not the best time for you to get the vaccine based on your current situation, we want you to know there's other options, and we encourage you to use those. We will be sure to release additional information on upcoming vaccination clinics and opportunities on all of our social media platforms, our website, and through these media briefings. As vaccine becomes more available in the community, we are hopeful that there will be more places available for those in our community to get vaccinated. We'll use every opportunity we have to get the word out through all of our communication channels. And now I want to move into our local situation. We have 517 new confirmed cases since yesterday's report. There are 5,078 active cases. 169 Knox County residents are currently hospitalized. Sadly, we have 9 additional deaths to report today, raising our total to 324. As we previously mentioned, the Knox County Health Department continues to vaccinate those who fall within 1A, 1A2, and those who are aged 75 years and older. Today, Knox County Health Department has received 4,300 doses and has administered approximately 2,400 doses, with the rest scheduled and for Saturday and our pre-existing closed points of dispensing sites for next week. Those are closed pods, which will primarily reach groups 1A1. As you can see from our data, our daily case increase is much larger today than what we saw the previous few days. And this goes along with our prediction earlier this week that the lower case increases at the beginning of the week were due to lower testing volumes over the holidays. Now we're going to likely start to see case increases jump as more folks are getting tested, which could account for the larger volume today. We are also, though, expecting that we will see a similar drop-off after the New Year's holiday. But the overall trend of new cases continues to be high. It's trending up, and that's not a good indication, especially when we look at our hospitalizations and deaths that we're seeing as well. And now with that said, we'll move on to the benchmarks. All of this data that we're going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction and stability of new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, our case counts remain high with an average of 391 cases per day. We want to note that the data over this time period didn't have consecutive red flags. However, we have seen a sustained high volume of cases, which is not a place where we want to be as part of our community. Because of this consistent high volume of daily increases, we are continuing to represent this benchmark as red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we utilize 2 bar graphs, one that shows a sample of tests conducted for Knox County residents, and another for average time between specimen collection and lab report data. Regarding testing, the total number of tests conducted has decreased since the last reporting time period, but is consistent with weeks prior. And again, we expected this. The issue we are continuing to see is with lab turnaround time. We did see an average turnaround time of 6.5 days in our community. But of note, this week we have been seeing much improved turnaround times, and we do expect the delay in receiving results to be lower in our benchmarks next week. Because of those factors for this period, however, we are continuing to represent this benchmark as red. Our third benchmark, sustained or increased public health capability. Of the cases that fall within the new prioritization structure, the goal remains to initiate investigations for new cases within 24 hours or notification and initiate close contact investigations within 48 hours of notification. Based on our internal assessment of capabilities and acknowledging the need to prioritize our case investigations and contact tracing, we are representing this benchmark as red. We continue to use our resources in the best way we can, with the understanding that resources are not unlimited, and are consistently looking at the best ways to accomplish this. We want to remind everyone to take personal responsibility and quarantine themselves at the first sign of exposure. Please do not wait for a call for public health to start taking action. Please isolate yourself if you have symptoms or have been exposed, and start calling your close contacts to make them aware so they can begin quarantining. Additionally, if you have been tested, Regardless of whether or not you have symptoms, you need to quarantine until you get your results. Our fourth benchmark, healthcare systems capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. These data are gathered from information hospitals put into the Tennessee Healthcare Resource Tracking System, and it may reflect Knox County, the East region, or patients from other jurisdictions. During this time period, flags were noted for positive inpatients, ICU patients, and ventilated patients. Numbers remain very high, with Tuesday marking the greatest number of COVID inpatients to date at 627. After speaking with our hospital partners, they have recommended that the benchmark be represented as red. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. Deaths have continued to increase in our community. During this time period, we have seen 58 deaths associated with COVID-19. This is an average of about 4 deaths per day, which is up from the 3 deaths a day we reported last week. This is not a direction that we want to continue down. The information available leads us to represent this benchmark as red. And under our supplemental data section, the first chart, shows new daily COVID cases per 100,000 population. As of Tuesday, our 14-day trend line shows 83 new cases per 100,000, and our 7-day trend line shows 60 new cases per 100,000. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health, and the 7-day average for percent positive in Knox County at the time this was pulled was 20.8%. And now I will open it up for questions.
All right, please go ahead and submit your questions into the chat feature. All right, waiting on questions. If you have any questions, if any of the media has questions in the Zoom, please go ahead and submit them now. We do have one question from Scott Barker with Compass. The community health assessment offers a pre-COVID baseline for Knox County. What do the results for COVID comorbidities like heart disease, obesity, diabetes, and other conditions tell you about the overall risks for serious illness and death from COVID-19 in our community?
First of all, I want to acknowledge our team for we released our community health assessment today, and this is a huge endeavor that happens every 5 years, and they have worked very hard to get it completed. COVID obviously slowed us down, and we. One thing that we want to also acknowledge, and then I promise I'll answer your question, Scott, is this is how we normally do data. So what you guys have been seeing throughout the pandemic is not how we normally do data. We usually spend a lot of time really analyzing and going through all of the data we have, and the team works very hard to be able to interpret that and put it out in a meaningful way. What you've been seeing, this real-time piece is not normally how we do business. So releasing the CHA today is a good acknowledgement of that. The community health assessment is really takes a whole team, and they've worked for months on this. So to answer your question though, Scott, we've said throughout this pandemic, and I think that the data that you would see in the community health assessment is that we have a high level of those conditions that put you at greater risk for complications from COVID-19 in our community. obesity and heart disease and respiratory illnesses. All of those things, we have it here, and it is concerning for our community. It will increase, if you get COVID, it increases your chances of being hospitalized and increases the chances that you'll die from this disease. And it's very concerning. And I think that we need to take heart to that and continue to acknowledge just the baseline risk that we have in the community, and ask everybody to do their part in protecting their neighbors and their family and their friends that fit into those categories, and all of us from this disease.
His follow-up question was, what specific comorbidities stand out as being particularly alarming?
And I think I hit that. It's heart disease, it's obesity, it's respiratory disease. The other piece in our community health assessment, which is really kind of the cornerstone of the work that we do here, is acknowledging that we had a baseline of high issue or concern and high levels of folks that have mental health conditions and that are facing substance use and abuse disorders, and that we started out before COVID even happened with having those issues and high levels in our community, and that we need to acknowledge that and acknowledge the impact that all of those things could have as we navigate COVID-19 as well.
From Austin with WATE, are we seeing a spike from Christmas, and what is your warning about New Year's celebrations?
We do think that perhaps we're starting to see illness from Christmas. This would be kind of the beginning of that time frame. This is actually probably more, though, folks that had illness a little bit before Christmas and are just starting to get tested because of, again, lack of availability for testing and us getting results in. And then, for New Year's, we cannot say this more than we have been saying, is we ask you to stay home, stay in your household, celebrate the New Year's with those in your household, or I should say, be creative. So celebrate with your friends through Zoom or FaceTime or some other video mechanisms. And we put out ideas, I think, yesterday, and Dr. Buchanan mentioned some of those, I think, or we did it in a press briefing recently, Tuesday. You can celebrate, have an online game night with your friends. You can toast together at midnight, all of those things. We ask you to, though, just do it safely, be creative, stay connected, but please stay physically within your household so that we can help, again, limit the spread and have impact within our community.
The next question we have is from Grace with WBIR. You mentioned that you all are expecting high demand for vaccines on Saturday. Why did KCHD decide to go with first come, first serve instead of appointment-based like some other regional health departments?
That was really wanting to provide opportunities since the new groups came in to give every opportunity to allow people to get vaccine. We already had appointments scheduled for next week, and we didn't want to further delay it. And we try not to put all of our eggs in one basket. We want to have a variety of methods for people to be able to get vaccinated. And this is just one of them. So we do have appointments, and they are scheduled for next week. And with our closed points of dispensing site or closed pods. And this is just another opportunity. But again, this is the beginning, everybody. Please keep that in mind. So if it's not a good situation for you, please don't do it. Wait until there is a better opportunity for you given your circumstances.
From Brian Hornback, how many vaccines do you have for Saturday's public clinic?
500.
From Austin with WATE, what are the logistics of Saturday's event? Will people have to stand outside and wait to get in, or drive through?
So we're going to get people in as quick as we can. There's going to be a queuing at 9. That's when that begins. The door opens at 9 a.m. So again, we are not asking, please don't stay in line outside overnight. And they will be counting people as they arrive. And as soon as we hit the 500, we'll let folks know. So we're not going to have people waiting unnecessarily, and we are going to queue within the building beginning at 9 as much as we possibly can. So they have it where we can do it safely as well with separation.
From Grace with WBIR also has a few logistical questions.
Real quick, ask everybody that's coming to please socially distance, keep 6 feet from you and the people in front and behind you, and bring your mask and wear your mask as well. Thank you. And if you're sick, don't come.
So a few logistical questions from Grace as well. She wants to know, will people have a place to sit down, and do they have to be Knox County residents?
They do not have to be Knox County residents, and there is not a lot of opportunity for sitting. If you have a wheelchair or something like that, then obviously you can utilize that. But again, we can't stress this enough, and this was kind of the hallmark of our message today. This is not the only opportunity. So if you can't stand in the line and it's not going to be good for you, please, this is the beginning. Wait for a better opportunity for you to get vaccine, and we will continue to push out how we can do that as soon as we are getting more vaccine and can schedule out further and let folks know about that.
Also from Grace with MVIR, how will you coordinate second vaccinations for everyone who gets their first dose on Saturday?
So everybody that gets their dose gets a card, and then they can register their given information. I'm looking at Dina, who's in the room, make sure I say this right. So you can speak up if you need to, or if you want to come up. But they're given a way to register to get reminders of when their vaccine comes, correct? Okay, I'm going to step off and let Dina answer that one.
There are a few different ways actually that we're reminding folks about that vaccine. First of all, you're going to get a card that says what the date is that you should be getting your next vaccine. The second thing is everybody that we are seeing is entered in our electronic health record system, and we will be sending out phone reminder emails. It's a call system that will send out those messages. So please share your phone number with us. The other opportunity is everybody is given as they come in a way to register on a site that's called vSafe. It also has a reminder system. You go in and use it. It allows you to let the pharmaceutical companies know if you have had any kind of reaction to the vaccine or any concerns about it. It allows that, and it also sets up a reminder system for when your next dose is due.
Another question about this Saturday asking what forms of ID will be accepted, and will there be security on hand?
There will be security on hand, and driver's license, and do we need a work ID are what we're asking folks to come to for the ones that are in the 1A1 or 1A2 category.
Any further questions, please go ahead and submit them now. All right, I'm not seeing any other questions come in, so thank you all for your time. We will see you again next week on Tuesday for our next media briefing. We hope you have a good and safe new year.